When I go in, close it, and then start breathing oxygen, I will be in twice normal atmospheric pressure. What you see behind me is a hard shell chamber. Clearly, I thought through it a lot before deciding on buying this. The decision often revolves around how much of an investment you will make on getting one of these chambers. And then the decision to purchase a chamber for yourself really depends on the commitment you have to this kind of therapy, which is actually a very, very heavy commitment. But people make these commitments because of their situation. So in this video, I'll be talking more about soft shell chambers versus hard shell chambers. Hi, my name is Dr. Mark Chern, and in the past year and a little, I've been doing a lot of research into what can be helpful for dementia and brain health. One of the interventions I've been exploring is HBOT. I've been using hyperbaric oxygen therapy on myself for almost 30 hours already, 30 hours. And in other videos, I share my journey from 0 hours to now, where I'm actually very familiar with usage of a hard chamber like this. This chamber is a 2 ATA chamber. 2 ATA means that it's twice the atmospheric pressure. Right now, I'm in normal atmospheric pressure. When I go in, close it, and then start breathing oxygen, I will be in twice normal atmospheric pressure. This is akin to being 10 meters underwater or 33 feet underwater. Let's talk about soft hyperbaric oxygen chambers. Soft ones are usually inflatable and portable. You can bring it around, you can set it up, you can deflate it and keep it somewhere and then use it again if you want to. Soft chambers have two benefits. Number one, if you don't need it, it's not going to take up space. Number two, it's cheaper. Soft chambers typically operate at a lower pressure. They usually operate at around 1.2 to 1.5 ATA. The ones I know are about 1.3 or 1.35 ATA. The reason why they cannot go much higher is because they cannot hold in the pressure. You need something hard, metallic, to be able to hold in pressure. Mine's a hard case, it is 2 ATA, and hard cases can go all the way up to 6 ATA. Now, pressure. Out here in normal pressure, it is 14.7 PSI. 14.7 PSI is 1 ATA. When we go into this hard chamber, my hard chamber is 2 ATA, which is double. In a soft hyperbaric oxygen chamber, it goes up to about 1.3 ATA. It's quite easy to calculate that will be about 30% more pressure. And even at 30% more pressure, we're gonna get some extra physiological benefits to the body. What happens is, normally in this normal environment, when I breathe in air, and air has about 21% oxygen, oxygen is being transported to different parts of the body through red blood cells. The amount of oxygen that can be transported to tissues needing it is sort of limited by the number of red blood cells you have. Things change when you start doing hyperbaric oxygen. What happens is you are breathing in 100% oxygen, and if I were breathing in 100% oxygen in this normal environment, I'm not going to see too much of a change, because even though I'm breathing 100% oxygen, I have the same amount of red blood cells. That really limits the amount of oxygen that can go to the parts of my body that need it. For me, it's my brain. At 1.3 ATA, which is 30% more pressure, what happens is that there is another conduit for pushing oxygen from the lungs to different parts of the body. And that conduit is blood plasma. It's as if you do not need to rely on red blood cells anymore. With that added pressure, oxygen just goes via the plasma to tissues in the body that need it. You can totally imagine, if 1.3 ATA does it for you, 2 ATA is going to do it even more. 2 ATA is medical grade, but it's not being too pushy. There's research on 2 ATA being done for dementia and stroke. So 2 ATA is worth it, and that's why I bought this machine. So that was pressure. Next, I'll be talking about the benefits of oxygen. Although it's something that we intuitively think as good, I still have some detractors here. So let's explain the good first. So the cells have little batteries or factories, and they're called mitochondria. Increased oxygen delivery to cells would cause mitochondria to produce more ATP. ATP can be just understood as energy. And with more energy, the cells can do more things. So if it's brain cells, these brain cells can fire more signals, and that's good. If it's liver cells, the liver is going to be more efficient at breaking down toxins. The flip side of more oxygen is being discussed a lot. And the first question that's being asked is, isn't more oxygen going to cause more free radicals? We understand free radicals as being something not so good for the body, right? But the research that's coming out is telling us that the increased production of superoxide, which is this free radical, which we associate as bad, is not so bad. So it turns out superoxide is very important for cell signaling. It is very useful for enhancing neurotransmitter function. It is very good for balancing hormonal balance. And of course, not to mention immune response. So generally, we understand oxygen as being good for you. Increased oxygen is good because it produces more ATP, and more ATP means that your cells are more efficient. Secondly, more oxygen means more production of superoxide. And superoxide, while it's a free radical, still has benefits as mentioned above. Cell signaling, neurotransmitter function, hormonal balance, immune balance. So should you go for a soft chamber or a hard chamber? One thing you can consider doing is going to a clinic and trying out a soft chamber, a 1.3 ATA, and then try a 2 or 2.4 ATA somewhere else and see how your body responds. Next thing to understand before making a purchase is how much you want to commit to it. So, of course, you can go and get HBOT treatment once a week, once a month, but generally, I don't think that's going to amount to anything. For example, in this hard chamber, you need at least 20 hours, or some people say 30 hours, to have observable effect. For treatment of brain conditions, you need to get to 60 hours in this chamber. That's where people start thinking, maybe instead of going to the clinic, which is far away from my home, I'm going to have one in my home. And because it's in my home, I'm going to use it all the time. So that's the thinking. And after that, they make a decision between a soft chamber or a hard chamber. A soft chamber is usually safer because it's not such a big increase in pressure. And you should not rule out the positive effect of a soft chamber. But you should also know that 1.3 ATA in a soft chamber is not going to beat 2 ATA in a hard chamber in terms of effect of hyperoxygenation of your tissues. So yes, you can get a soft chamber and it's going to help to some extent. And if you want to improve performance, why not start with soft chamber? But if you're thinking about conditions, for example, I'm thinking of my brain condition. That is why I opted for a hard chamber, and that is why I want 2 ATA at least. Ultimately, it comes down to what you want, how much you want to commit to it, which then determines how much you want to spend on it. To wrap up, my hyperbaric oxygen journey has just started. I am clocking around 30 hours already, and I'll be sharing more about my journey in these videos. Whether you're just starting out and deciding soft chamber or hard chamber, or if you already started on something and you want to connect with me and share your experience, I really appreciate it because ultimately there'll be more and more people around the world using HBOT for different purposes, and having a community is very, very useful. So come make friends with me.